Aloha, everybody. Welcome to another special episode of Optimize Your Naʻau. I'm Dara.
And I'm David.
And today we have a very special guest. Our midwife, Jasmine Merritt, who owns the Essence of Birth in Honolulu, is a certified professional midwife who offers full spectrum midwifery and doula support, and also does Bekung belly binding and placenta encapsulation. We're having a beautiful conversation today around conception, around mindful conception, mindful pregnancies and deliveries, and the different ways that every family, no matter what their cultural beliefs are or cultural practices, can always be supported. So aloha, everybody. Welcome to our Naʻaupono podcast, Optimize Your Naʻau. We are here with Jasmine Merritt, our midwife.
Aloha.
She is the owner of Essence of Birth in Honolulu, and we're going to talk about her offerings of her full spectrum midwifery, supporting families, supporting mothers, supporting communities, raising children, really.
Yes.
We're going to talk about women's health. We're going to talk about male health as well. We're going to talk about all kinds of things. So let's just get right into it.
Right into it.
Yeah. So first of all, where are you from?
Yeah. So I am from Montgomery, Alabama. I've been on Oahu for about 8 years.
Okay.
I left Alabama after getting my degree in public health at the University of Alabama. And decided, you know what, we need more midwives. And
Yes.
so the area that I'm from, midwives were eradicated back in 1970.
Wow.
So the Black granny midwives in the South, the last group of midwives, they pretty much stopped in 1970 due to the legal side of everything in Alabama, with just pretty much saying no more midwives. And so in college, I had the opportunity of being a doula before I even knew I was a doula.
Nice.
People were really interested in me supporting them.
Mm-hmm.
So whether they were terminating, or whether they found out they were newly pregnant, or they might have found out they had an STI, I was some way that person that would attend, appointments and just have people stay in my dorm room and just take care of them. And so, when I realized that Alabama was ranked number 3 in maternal mortality in the entire United States, I realized, okay, what is the issue here? We have a lot of rural communities that are healthcare deserts. And so there are not a lot of providers or hospitals in those areas that can serve those people in that community. And so I was working in HIV/AIDS research. And so I would go out to the rural parts of the communities and really just work with people who are HIV positive, getting them resources, counseling resources and everything. And then realize that on top of that, there are also women and children in this community that are not being provided the best care, right? And so really just decided, you know what, someone was like, you could be a doula. And I was like, what is that? And so every time I wanted to do a doula training, there was never anyone available. And so finally, I decided to join this training, and we were the only cohort of Black women in that area that had done that training in a while. But then I realized after doing a few births that, the medical system is different. I don't know if this is what I really want to be a part of. After getting my degree, I wanted to go to medical school and become an OBGYN. But there was something about being in the system that just did not correlate with my spirit, right? And so I realized that how am I really able to serve a community if I have to abide by these strict guidelines and principles? And so it just didn't resonate with me. And so I was like, well, I need to be able to learn from people who look like me and people who understand culture and understand cultural responsibility, And so my family, my brother was out here and he was stationed here, and I had stalked a few of the midwives here, elder midwives, and I had to research them. And I was like, look, I'm coming out here and I just want to come and I want to learn and I want to be able to provide my community with the research and the traditional experiences and the culture, because that's something that I'm lacking in my own community. And yeah, and I sold all my stuff and I moved here in like 3 to 6 months. My folks thought I was crazy. And yeah, it was a blessing.
Yeah.
It was a blessing. And it was a big cultural awakening for me,
sure.
right?
I'm sure.
But just being here and there's so many gifts that I feel like I've been provided, and it was just really, it's been a great experience for me and very humbling. Just being here has taught me so much about culture and the love of culture, and you know allowing myself to support so many Native Hawaiian and Black and Indigenous families here. I mean, it's mind-boggling at how much our ancestors have been helping us, guiding us in this work. And so anyway, so that's kind of been my journey this far, and I'm just grateful.
Yeah. Well, we're so grateful that you're here because,
Yeah.
I mean, I know we've said it before, but I mean, this third pregnancy was a complete and total surprise. And, we're so grateful and we feel so blessed.
Yeah.
But not even out of left field. I don't know, like just from, felt like it came from another universe. And at the time, of our youngest who just turned 9 yesterday, our midwife at the time was 86.
Yeah.
Right. And so when we found out that we were pregnant with this one, I was like, oh my God, David, we need a whole new team.
Yeah.
And I didn't even know, like I had met you before.
Yeah.
Right. So I got a recommendation from a friend. And the moment we spoke on the phone, I knew, just the connection was there. And so we're so grateful that you're here and supporting us.
Grateful for you all.
Yeah. Yeah. Yeah.
Yeah.
When you talk about cultural practices, within midwifery and within your work, how is that different from what you experienced in a hospital setting?
Oh, yeah. I believe cultural competency is a really big thing when we are working with all types of ethnic groups and backgrounds. And so, when you are in a healthcare system, a lot of times, when they're taught their medical training, they're not taught to understand and to appreciate and respect that, right? When we look at the history of obstetrics and gynecology, we look at, a lot of medical injustices that have happened to a lot of Black and brown bodies, right? And so when I think about cultural in terms of the medical system, that's not really something that is prominent. That's not something that is understood. That's not something that's respected, because it never has been respected, right? When a lot of times when providers look at their clients, and not all, but some, they look at what does this medical textbook say about this specific client, right? And they treat them accordingly to that. Whereas in my training as a midwife, we were taught that, okay, let's look at their culture. What are the things how do they eat? How do they move? What are their religious cultural practices? How can we really invite that into the pregnancy, invite that into conception, invite that into the postpartum? And also, how do we connect family in that as well? And so I think that, when we look into the medical system, that's not something that is even allowed.
Right.
Right. And so, whereas in midwifery, we invite that not only in the pregnancy and the postpartum and the birthing space.
Yeah.
We have mamas that are praying, or mamas who are chanting.
Yes.
Family members who are chanting, or just holding that space for their families to allow this baby, allow this mama to be able to meet each other in a very sacred way.
Yeah.
And, we have seen time and time again in the medical system that birth is no longer sacred. It's just a thing to do. It's just a medical diagnosis, And so in midwifery, in, the work that we do, we really, that's like the top, like the head of how we practice and the work that we do.
Yeah, and I just want to throw it out there, like there is no better way, right? Like there's a time and a place for everybody to choose how they want to have their birth. And this is not better. That's not better. It's not right. It's not wrong. It's what fits you and your family. And that's really what, this conversation is about. Right. We had the experience of giving birth in a hospital, and it just wasn't for us, which is why we decided to have our second at home. And the reason why we're deciding to have our third one at home too, and one of the things we were talking about before we started recording was education, and I think that's a huge piece where a lot of families, not just mothers, but partners and families, right? I will say, personally, when we first expressed that we were choosing to have a home birth for our second one, our family was very fearful because it had never it was never experienced before, right? They had nothing to base off, had not really heard of it. Nobody in our family had ever done it, and so it was very very scary for our families. And this is where I want to emphasize, as partners, right, whoever you're, as partners, like you folks gotta be like in that decision.
Because gotta be on the same page.
Because 100%. It involves not just he and I, it involves our family, right, the child that's about to be born, and really, this is my opinion, but the trajectory of that child's life, even, there's so many things that can happen. That's such a sacred moment. All these things, all the small little things, that the emotions that play a part, right? The words that are said, the feelings that I'm getting emotional because it's an emotional moment,
It is.
But what I wanted to ask was, on the education piece, you were talking about conception. And I feel like I wanna talk about that, how important it is for not just mother, but father and those that mother is connected with, prior to conception, during conception. Like, why is that so important? Right? Health and wellness.
It's so important because it's the intentionality around ensuring the longevity and survival of this family, this unit, of this baby, of this future. And, I'm really big on conscious conception. I'm really big on even the moment that you conceive, even if you were not conscious in that aspect, but just moving forward from there, being conscious about the way you speak to her, the way you hold her, the way you breathe life into her, the way you breathe life into your baby, the way you hold space. We need our partners. And it's really important for them to feel supported and guided along this journey, because their strength is what grounds us in those moments of vulnerability at birth. And so for this child, one of the biggest things for me is that when a child is being born, it is so important for me and my team to just keep quiet. The first voices that I want this child to hear is the voices of their parents. And so it's important for them to feel that for everything that the father or the partner does for this birthing person or this mother, to really be able to have that connection, right? And I think that, it's not about the mama just eating right. It's not about, the mama just making sure that her stress levels are down. It's about the father too. It's about the partner too. Because it helps the whole atmosphere of the postpartum and the pregnancy to be in unison. And so the biggest thing, that I see, in terms of conscious conception or conception, is really making sure it starts before you even realize you even want to conceive. You have to be on the same page.
Yeah.
Because birth and having a child, it rocks your world in so many ways. It flips your whole world upside down.
Yeah.
And so it's also important that anybody else who's connected to you all is intentional in the way they choose to be a part of your unit. You know, and so having the partners there to pretty much protect you, to surround you with love, to be in community and be in like unison with you, it allows a flow. It allows the birth experience to go so much better. It allows the postpartum to be so much smoother. And it just, when you think about the children and you think about how they grow and how they learn love and how they learn protection and community, it all starts with that.
In utero.
In utero.
Right? Yeah.
Yeah.
Yeah. And, you know, there's so many studies, you know, and we were even diving into some of them more about just how safe the baby feels before it even comes out.
Yeah.
Right. And you're talking about the words being used, the, you know, the emotions, not just of the mother, but the emotions, you know, around her.
Yeah.
Yeah.
And we forget that babies can hear.
Yeah.
Oh, yeah. Oh, yeah.
They hear and feel.
Yeah.
They feel.
Yeah.
And so really just sharing that your voices with this child before they're even born, it's just it's so important.
Yeah.
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 And we were talking a little bit about something that's interesting that, you know, it's new information for us about you know, the rate of miscarriages or reasoning behind miscarriages. A lot of times they're finding more research that it does more and more depend on the father's chromosomes. You know, so I don't know, that's something that's new to us. I don't know, you know, if you have any information that you would like to share on that part too.
I think definitely, you know, the research does show that it's based off of the father's chromosomes, but also the health of the father as well. I think that is so important.
Yeah.
I think that we don't talk about that enough. Our society does not talk about that enough. A lot of times when we think about infertility and we think about miscarriage or loss, and we automatically put the blame on the mom. We almost always put the blame on the mom. And we never take the time to look at the partner and their lifestyle and their health choices.
Right.
And so I think that, you know, our society could do a better job at really just honing in on how do we make this dynamic as healthy as possible. How can we just not only look at the mother, but also the father, also the energy, also the spirit. Also, you know, I'm also into spiritual conception as well and spiritual fertility. And, you know, I think it's very important that we even ask this child, you know, even when we're conceiving or even when we're putting that energy out that we want to manifest this child, what do you want? You know, it's not really always about us. And when we start taking ourselves away from that and really honing in on the spiritual aspect of fertility, conscious conception, marriage, whatever, relationship building, whatever you want to call it, it'll allow us to not always feel like we have to point the fingers and place the blame, you know? And so I think that, yes, research does show that. And I think also it's just confirmation that there's some deeper work that needs to be done that I think our society and community just has not honed in or touched yet. So, yeah.
Yeah, for sure.
Yeah.
I mean, and we, you know, we have customers that come in, you know, wanting to conceive, but it's always the female that comes in.
Yeah.
I have had maybe, well, less than a handful at least of men that, you know, are just looking for some other solutions because some of them are either in contact, you know, with a provider that is giving them that information.
Right.
Or a light switch goes on in their brain. They're like, oh, maybe it's me.
Yeah.
You know?
Yeah.
But whatever it is, it should still be a conversation that should be happening with that couple or that, you know, that support, in other words, right? Because it's not only just one person.
Yeah. And I think also knowing that you have options.
Correct.
There's so many different alternatives besides Western medicine that can really help you in conjunction with that as well, if those people choose that can really help you in like navigating this this journey, so that it's not just all medical based, all fear based, but it's also like helping you to heal even things that you didn't even know you needed to heal. You know, to be able to have that portal open. So yeah.
So, we know what it's like to have a home birth, right? But there could be a lot of people listening to this and be like, what does that even look like? Like, what does it even mean to have birth at home? So I don't know, do you want to share, what that would look like?
Yes, I would love to. Having your baby at home really looks like just a lot of different angles and strategies and ways. It really hones in on the type of care that families want. Really the holistic aspect of birth and the care. And so we look at, not only do we talk about the nutritional aspect of birth, not only are we talking about the spiritual aspect of birth, not only are we talking about how do the partner and the family support, but we really hone in on what do you want? We talk about the autonomy. We talk about the opportunities. What are some things that, because I even have mamas who want to birth in the hospital, but they want to choose midwifery care. And that's something called Montrese care, where they choose to have that midwifery support, but they might want to birth in the hospital setting. But for those who want to birth at home, it really looks like a holistic package of love, right? So we are honing in not only how are you doing physically, but also how you're doing spiritually. We're also holding you accountable, right? Because home birth, it takes work. I think a lot of people, when they think about birthing at home, they think, oh, okay, I just hired me a midwife and I'm just going to have this baby out. No, it takes a lot of work, and I really require my clients to have a full body yes when they're choosing to go this route, because of the amount of accountability that it takes. Right. We also provide a lot of appointments with our clients to make sure that they're getting the best type of care, right? So we're spending about an hour each time going over all of this information, making sure you prepared for childbirth, making sure your partner's prepared for childbirth, your children are involved in this as well. And also, talking about the follow-up, we provide 24-hour support. Day 3, 1 week, 2 weeks, 4 weeks, 6 to 8 weeks, and really just honing in on how do we make sure that you and this baby are bonding, you all are thriving, you are cared for. We have backup midwives, we have doulas that are a part of our team. We bring and invite physical therapists or pelvic floor therapists and lactation counselors. And for some people who want to do collaborative care, we have some providers on island that will actually see them as well, on top of also seeing us midwives. So it's really like a holistic journey, of care. And so, some of our clients birth in the water. And some of them don't, right? And some of them birth outside with animals, and some of them don't, right? So it really is just whatever they want the journey to look like, but our care is solid, and is thorough, and so we just make sure that everyone is supported the best way that they can be. So
Yeah. And, going back to the full body yes, I highly recommend both of you have a full body yes.
Yeah.
Because it's really difficult when one is fully on board and the other one is not. I mean, it can be very difficult. It's, in that moment, I mean, it's, how do you say, that moment of giving birth? I mean, it's like a small war. And you need your partner, and they need to be there just as much as you are, right? So both of you, definitely, I recommend both of you being 100% on board. What about in cases of emergencies?
Yeah. I think that's something that's really important to talk about, because that really comes up with a lot of the partners. They're like, okay, we love this, but what about emergencies?
Right.
What does that look like? And so, we have plans. We have protocols in place, we home birth midwives normally take low risk clients. right? And so low risk can look like a lot of different things, but those who need to birth in the hospital, we make a plan for that. If things come and they arise in the pregnancy that no longer make it safe for you and baby to be born at home, then we go in and support you in the hospital setting as your midwife/doula. And then when you leave the hospital, then we follow up with the postpartum care. But sometimes emergencies do arise at birth, right? And so we talk about how do we navigate that. We have protocols in place. We carry oxygen, we carry herbs and homeopathics, but we also carry Western medicine in the event we need it for oxygen support, respiratory support for baby or for mom, or even postpartum hemorrhaging support as well. So we talk about all these different things. We are able to suture, up to a secondary tear with lidocaine. So we do have a lot of different ways that we support families, and depending on what it is, we talk about that ahead of time in the prenatals. So that way, when that time arises, or if that time arises, they know, okay, my midwife team knows exactly how to support. And so all of the midwives in our community are really trying to work hard with a lot of the EMS personnel to really make the transition to the hospital a lot smoother, which is why sometimes we do have some of our clients choose to also work with a provider in the hospital setting. So in the event if they needed to transport, that relationship is a lot smoother because they've been seen already. Right. So a lot of providers are not very supportive of home birth, but there are a select few, and so we really appreciate all of you who are, because it makes our job so much more easier, and it also makes that relationship so much more healthier when the client and also the midwife team knows that our clients, when they're transported to the hospital, they're being received with love and support, and not just condemning them for their decision that they chose to make.
Right.
Yeah.
I mean, so this decision was, right off the bat, like as soon as we found out we were pregnant, we're like, okay, we got to find ourselves a midwife, right?
Yeah.
But what if there's somebody right now listening and they're 30 weeks pregnant, and they're like, damn, when is too late to change?
Good question.
Yeah, that's a really, really good question. It's really hard for me to say when it's too late, because during COVID, we really supported people who were 40, 41 weeks, and they chose that, today I don't want to birth in the hospital anymore. I want to be at home. And so maybe you've only known them for a day or two.
Wow.
And then you supported them for their birth. And that was a lot.
Wow.
Right. And so for me, it really depends on the family. I'm really big on connection. I'm really big on making sure that it feels right. Right. I use my intuition to help guide me to make sure that it's a good fit, not only for them, but also for me and my team as well. And so I've had mamas who came to me at 37 weeks. I've had some as of recently who came to me at 39 weeks. And only might have known them for a week or two.
Wow.
So really, I'm open to taking someone into my care, even if they're later in the third trimester, but it just would need to be the right, right relationship for me and my team to be able to feel that we have that trust on both ends.
Yeah.
Yeah.
Are there any situations that you wouldn't take? Like, any twins, breech?
Yeah.
I don't know.
So it's great that you asked that. We have experience with twin births. We have experience with breech births. We have experience with women who've had C-sections before and they want to achieve a vaginal birth. Some places, especially on the mainland, some states do not allow for midwives to practice in those settings. But here we have the autonomy to practice, and a lot of bulk of our training is that, right? But if there was issues where there might have been like a bleeding disorder, disorder, if there was some other high risk, gestational diabetes that was not managed, or something that would make the entire pregnancy high risk, then that might be something where we would support the family in the hospital setting. But twins or breech or women who've had previous C-sections, that does not make them risk out of care for some midwives.
Yeah. or posterior,
or posterior,
which has been my experience.
Right.
Twice. So, and Jasmine has taught me that there are different types of stretches and exercises that I'm gonna do my best to do to just try and get this baby to turn all the way. But I do have a friend who gave birth with Selena Green, which was your mentor. And she had twins at home. And she had a beautiful birth. So yes, these are all possible.
For sure.
I think it's interesting to get educated on just the alternative methods of how the baby can turn. And it makes sense to me. The more educated you get on the nervous system, how you're giving input. You're into your own body and your own nervous system as a female, at least.
And passing that along.
It's very, very intriguing to me.
And a lot of the going back to the culture wise, so important. A lot of the traditional practices that we are taught, or the skill set that we are taught in helping to turn a breech or helping to turn a posterior baby, really, it really matters, especially when you're taking care of a mom who's in labor and maybe baby's persistent OP. We think about all the different maneuvers, the different hip squeezes, the different rebozo, the shifting of the hips, the sideline release, the constant movement. And so a lot of the education that we provide to families and to partners is being able to, how do you assist these mamas in labor to make sure that baby stays in an optimal position? Right. And so that's a lot of our training as well, not only as midwives, but the training that we learn is also the training that we provide to our families.
And we appreciate that so much, because I feel like, I'm just going back to our previous experience in the hospital. We didn't get nearly as much educational information as we did, with our first midwife and with you. I think the transparency, the openness, that's the thing I feel like we connected with the most.
Everything was very stressful with our first one. In retrospect, at least. In comparison to the other pregnancies, everything was, you got to rush. We got to get it done. It's an emergency. And meanwhile, we're watching, through the monitoring, where his heart rate was
even keeled.
He was good, man. He just wasn't ready yet. He was chilling out.
And that's the biggest thing in the care that we provide. We know how to sit on our hands. We know how to give it time. A lot of times these babies just need time. They need time to maneuver. They need time to transition. You need time to rest. You need time to nourish your body. And I think a lot of times in the medical system, in the hospital setting, they don't have that time to wait.
They don't.
They don't.
They don't have function off of that.
Everything
business,
is, I don't know if you all have ever seen the documentary, The Business of Being Born.
Yes, the one with Ricky Lake. It was an amazing documentary. It was a very, because she showed both. And she had both experiences.
So it really allows a lot of people to really understand how obstetrics and gynecology works in this medical day and age, and how, having alternative medicine, alternative support when it relates to childbirth is really important to really tap into, because whether you choose to birth at home or you birth in the hospital, you should always have support and someone advocating for you. And so when you think about the medical system, they don't have that time. They're working off of a short amount of time, trying to get paid, and everything is really how,
And to what you said, our second my second pregnancy with our daughter, I started bleeding right, like 2 weeks prior to the due date. And I was like, oh my God, what do I do? So called Medra, right? And she was like, okay, Dara, I need you to calm down. Just relax. And, maybe stop doing what you've been doing. What have you been doing? She's like, are you still working? Maybe your body's telling you don't. She goes, don't worry. It will regenerate, right? Which I never knew. I never knew your plug could regenerate. And it did. And then, 2 weeks later, it broke again, and then we had a beautiful birth. But
I remember that.
But those are
That was around my
things.
birthday time.
Yeah, it was on your
I
birthday
remember
time.
like, no.
It's not the time.
She can have her own.
Her own
She can have her own
birthday.
birthday. Yeah. I remember that. Wow.
But if I were to have called, my Western medicine doctor, it would have been an emergency.
Yeah.
You
You would have been rushed in.
We would have been rushed in, right? And that's the educational piece. The experience, really, that I value so much, from you ladies.
One of the things I appreciate, coming back to what you mentioned earlier too, are healthcare practitioners that have, courage, number one, but also just the desire to get educated on what else could be possible. Like we get so fixated sometimes, because of how we're educated within the system,
right?
On this is the way it goes, and then you just pass it on to the next specialist, right?
Yeah.
And they're the only, they're only educated within that. Sorry,
right.
I make this box.
Yeah,
right?
yeah, I get it.
On purpose, but a lot of us should be looking a little bit more outside, right? And just to get educated for us to get over the fears, as we mentioned earlier, right? And how to support, not just our own partners, but our own patients,
right?
On just some other possibilities, right? And, I find that, once we get educated more, like we can be there in such a different way, as a healer, and super, super important to be a part of that version of support for our patients, for our clients.
Yeah.
So. Yeah, and I think the biggest thing is, when we fear something because we don't have enough knowledge.
Exactly. Exactly.
And kind of going back to what you were saying earlier is that, what if you have a mom that comes in and she's really wanting to have a home birth, but the partner might not be. It's because of that fear, and when the more that we communicate and they seek the more knowledge and do their own research, and they're like, oh, wow, okay. We got that, understand that a little bit more. That settles well in my spirit. So let's maybe come together and make this decision together.
Yeah.
Right.
And going back to what you said, I think people don't realize how involved it is for us.
Oh yeah.
Like you have to really be involved. And I feel like that's why you said, the full body yes, like effort comes from us too. A lot of it.
And a lot of times when you have that unison and that unity, you see it in the outcome, right?
Absolutely.
You see it also, in the postpartum. You see it in just the longevity of this child's life when the parents are together and their understanding of how they want to intentionally bring this child into the world, also how they want to parent this child. And it, like you said earlier, it goes back to the conception and it goes back to being on one accord. So
consensus.
Yeah.
I think postpartum is something that's not really, talked about enough or even just focused on. A lot of, you had your baby, okay, here you go, good luck.
Yeah.
Right. But real postpartum, I mean, when you look at, culturally, I mean, it's like months in different countries.
Yeah.
Right. You're in the hospital for a while.
Yeah.
With postpartum care, which, we don't provide here in the U.S., which we really, really should, right? So nutritionally, emotionally, right? Exhaustion is a thing. Lactating, I feel like that for me was harder than giving birth. That whole like the nipple swelling, the sores, and all of the things that you just you don't even think about until it's happening, and then at that point you're like exhausted,
right?
And don't like what do I eat, what do I drink, and you just feel like you want to give up. But I did want to talk about placenta encapsulation as well, because we didn't do that with our first, but we did do it with our second.
That was mind-blowing, by the way.
It was.
That was such an educational experience.
I mean, my bleeding stopped.
Yeah. Oh gosh.
I had milk right away.
But it was your brain function too.
Oh yeah.
And the balancing of your
Nervous system.
hormones. Like it was just night and day.
Yeah.
You know?
Yeah. The placenta is a beautiful, beautiful organ that both of you create, right? And so when you think about what the placenta does, it works to not only protect you, but also to protect your baby, to nourish your baby. You know, when the placenta is born, we tend to look at the placenta, we look at the maternal side, and we look at the fetal side, and we can tell based off the placenta, it's like a report card almost, right? We can tell how well, you know, this baby was being nourished, how well mama might have been nourished, or, you know, if there were any possible ailments or anything that could possibly be a factor into the well-being of this baby. But the placenta holds so much nutritional value, right? And so in our culture and society, it's not really, you know, it's not really important to even take your placenta home, especially if you're giving birth in the hospital. You don't even have that option, right? It's like, okay, we're gonna get some cord blood, we're gonna wisp it off to pathology, and you may or may not be able to pick up your placenta, right? And so one of the things in midwifery care is that we invite families to really, really think about the nutritional value and the support that the placenta encapsulation does for your body in the postpartum. Not only does it help with regulating your hormones, but it also helps with blood loss. Right? Iron. It also helps with re-establishing those hormones to help those prolactin hormones to help with breastfeeding. Right? And so when we think about the placenta, the size of that placenta is the size of the wound inside of your uterus that has to heal. Right? And so when we look at that and we really understand that, that is why animals, if you pay attention to certain animals, they eat their placenta because they understand that this is what my body does, and this is also what will help me to prevent bleeding and all these other things. So I think our society now is slowly starting to understand and realize that, and but it's still an ongoing you know, journey into showing and sharing the importance of it. So for a lot of our mamas, we do the placenta encapsulation, and that process normally takes anywhere between 24 to 48 hours of encapsulating the placenta, dehydrating it, and getting it into the capsules, and to make sure we're bringing it back to you in a timely fashion to make sure that you're able to reap the benefits of the placenta encapsulation early on. Right? Some of my mamas take little pieces and they put it in a little smoothie, or they'll take it down. So that's an option as well, or tinctures, you know, but it does hold a lot of benefits. You know, even for when you go through menopause, or when you also your child goes through puberty, you know, and so we make tinctures that can also help them as well to kind of transition into that period of their life also. So
nice. I never that part I didn't know about that part. And I'm so grateful that you folks encapsulate it. I know that there are different cultures that will make stews with it for the mother to eat, and I'm not gonna do that. I'm gonna put it in a pill.
That's extreme for you. Extreme for you.
Swallow it without having to chew it. And
you know, the words that are kind of coming up in my head while we have this conversation is, you know, in the medical field, traditional medical field, right? They talk a lot about how important being sterile, the environment being sterile is. But as we've learned, you know, through a number of different, just not even experiences, but even just through educational opportunities that we've been to, you know, sterility is actually a lot more harmful, right? And so, you know, the things like this, right, like placenta, you know, encapsulation, there's a lot of fear around, like, oh, that's not, you know, healthy, or not healthy, but you know, clean, right? It's not clean, right? Or even we can even have the conversation about the delivery at home, right, being not a sterile environment. But you know, the more and more we've done research on biome, I mean, we're talking about like 10 plus years. We're understanding that like such an important element of health is biome, right? And we have different environments all over our body. I mean, they just discovered that you have your own on your eyes, you know. But you know, what's really neat is what I'm noticing especially with the placental encapsulation and the response after that, it had an effect on how her biome functioned. She was ready to go. She was ready to eat her rack of lamb. Like I had it in the oven already. She's smelling it.
Yeah.
But yeah, she was ready to provide the nutrition that we needed to pass on to our child. And I mean, for those of us or those women that are able to do the vaginal, delivery, and even just being educated on the importance of that being passed down, right?
Through the bacteria, through the vagina. Yeah.
And how important that is for their biome and for their health, right? Rather than, these scheduled C's, which like blew my mind on the, on how people, how common. How common that or practice that is. Like that connection is lost.
Yeah.
I know I don't mean to sound judgmental on it, but
no, I mean, and there are definite like legit, emergency C-sections.
Correct.
And you can still reach out, to have your placenta encapsulated, and
Yeah, and we work with a lot of different families. There are some families who need to have a scheduled C-section.
Yes.
Right. But I think also understanding that there are things that can still be done. We talk about, for a lot of my families who need to have a scheduled C-section, gentle C-section, right? Where that is where baby, you're able to do skin to skin, or they're able to lower the drape, or you're able to listen to some music, or you're able to make informed decisions on how you want the C-section to go, how you want the baby to be taken care of afterwards. Do you want a birth plan that really encompasses what you really want? Although the birth might not be something that you had planned or wanted, you're still able to make decisions versus decisions being made for you, right?
Yeah.
And so we do have some families who still want to encapsulate, and we still encapsulate the placenta, right? Because that still holds a lot of nutritional value, specifically even more for them as well, because of the way the delivery went, right?
Yeah.
And then we also have families who, maybe it wasn't scheduled. Maybe they birthed in the hospital and they needed to have or maybe they were attempting to birth at home and then needed to transport and then still needed to have a C-section, right? And so we talk about all of these things, and also why placenta encapsulation still is something that you can still obtain and still have, or having your placenta. Some families don't even want to encapsulate it. Some of them, culturally want to bury it, right? And so we talk about the importance and the significance of that, and making sure we honor that as well. So I really love the midwifery model of care, because it allows us to really provide this space and this decision making into the family's hands.
Yeah.
And we're here to just navigate and guide and nurture and support and not really manage, right? I hate that word, manage. We're here to help guide, right? We provide you the information that we know. We provide you with all of these resources, and then you make an informed decision, right? And so I think that, different midwives practice differently, as well as different doctors practice differently,
right?
But really making sure that they are always in the driver's seat of their own birthing experience and journey. So
yeah. And you taught me something, and I just want to mention it real quick. You were talking about vitamin C, and it made me think, because you were talking about how babies develop their own microbiome, as they should, right? I mean, like, I'm not going to provide everything that the baby needs, and I shouldn't, right? Because babies should be trying to create their own environment. And you were talking about me being careful about taking too much vitamin C. Right?
Yeah.
Can you talk about that for a little bit?
We don't want to do vitamin C overload. Right? It's really important to allow our bodies to build the immunity in other ways. Sometimes I think sometimes too much of one thing can be a lot. There are other ways. Of course, vitamin C is really helpful in building the amniotic fluid, right? But sometimes too much vitamin C, just like too much herbs or too much of something, can really also be harmful to you as well. And so I'm really big on navigating a variety of different immune boosting support, right? So maybe it's vitamin C, maybe it's some echinacea, maybe it's some burdock root, maybe other healthier herbs or other things versus just solely putting all of your energy in one area.
Right.
You know, vitamin C is also really, really great at helping, as well as helping to boost iron too, along with taking iron supplementation. So I always just tell people just kind of everything in moderation,
Right.
everything in balance, you know, not too much of one thing.
Yeah. 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 And you mentioned, you know, allowing baby to make their own vitamin C even, right?
Vitamin K.
I'm sorry, vitamin K. I'm sorry.
Put that one.
I was like, vitamin K.
It's all good.
Okay, it's okay.
Yes.
Yeah.
I'm still learning.
Yeah, no.
Still learning. Only the third one.
No. It's okay.
Still not,
it's okay.
Hey, you know,
still not
there's
even
no judgment. There's no judgment.
Not even gonna be close.
Yeah. But yeah, vitamin K.
Yes.
Yeah, I mean, you know, when we think about vitamin K, babies tend to not make vitamin K on their own until around day 7 to day 14. And so in the Western medicine, they believe that, you know, vitamin K is very beneficial, especially if there are any signs of trauma to baby's brain or to their skull, right? So maybe you see broken blood vessels, maybe you see a cephalohematoma, maybe there was a very harder, more traumatic birth for baby. And so because baby doesn't make vitamin K on their own until a little later, if there are any severe signs or any signs that there are internal brain bleed, you might not catch that until it's a little later, right? And so having that vitamin K at birth, a lot of providers feel that it will prevent them from any type of disabilities or any type of trauma, long-term effects that not getting vitamin K, you know, not having that blood to clot, right? Because it's the clotting factor that, you know, you want baby to have. Not getting that vitamin K could provide some sort of issues for baby, right? Trauma for baby. And so, you know, I have families who do vitamin K, but I also have families who choose not to, right? Especially if there were not any significant issues at birth. Right. So it really is up to the families and is really up to what their choices are. And then also looking at how the birth goes. Right. So I always provide my clients with the opportunity to make their own decision. Some people don't do vitamin K, some people do vitamin K, or some people do oral vitamin K. Right. So, you know, in Western medicine, they also feel that oral vitamin K is not sufficient enough to prevent any type of issues that baby might be provided if baby didn't get any injection, muscular injection. So I'm someone who truly believes that it's up to the parent's decision to make. But if there are no issues with baby, then I don't think that it'd be warranted. So
I like that.
Yeah.
Well, this has been, you know, such a nice conversation for me, obviously learning. Every single time, you know, we talk to you and so grateful for that. Is there anything that you wanted to mention that we didn't get to talk about?
You know,
in this conversation?
I appreciate you all for bringing me on this podcast. This is my first live podcast. But I just really appreciate the community, like relationships that you all have, the education that you're providing to your own community. You know, I really feel that this is really beneficial and just helping to edify our community and just being more self-aware and knowing exactly what other options are available to them and tapping into their intuition, right? And, you know, some people might have thought about, home birth or placenta encapsulation, or just working with a doula or a midwife. And so I hope that this podcast segment is able to provide them with more resources and more thoughts and also the partners to really step up a little bit more and saying, you know what, let me do my own research. Let me ask some questions. And let me, tap outside of that fear-based mentality that I might have been taught or, might have came up because this is my first time stepping into this unknown territory, right? And so I just appreciate you all, and I just want to say thank you for the opportunity to serve you all as your midwife, and I'm looking forward to seeing how our relationship grows together.
Yes, absolutely. And we're going to be posting, more of our journey with Jasmine, but even, through our, holistic pregnancy, I guess I'll call it. I mean, to me, it's just a pregnancy and our home birth. And, any questions that you folks may have, you folks can definitely DM us. You can call into the office. Ways for you folks to get in touch with Jasmine. She does have her Instagram account. It's Essence of Birth, which is on Instagram. Any other ways?
Yeah, I am also at Essence of Birth. My website is essenceofbirth.org as well. My phone number, 808-269-6272.
Love it.
Yeah, you can also look us up on Google. We have reviews as well. Any type of way, any type of social media, you just type in our name and you should be able to find us. So
and we'll put all of this on the bottom of the notes too that you folks can refer to.
Yeah.
Before you go, we want to make sure that we always ask these questions that we always do on all of our podcasts. And they revolve around connection, right? It's a native connection, as we have mentioned in the other podcast, which is just our healing through connection, in other words.
Right.
And so what would be that experience or that person even, or what have you, that has created that healing connection or that's a native connection for you?
Yeah. I would say the connection has been, the communities that I serve. That is my connection. I think being here, I was thinking about that on my ride over here, and I was like, my connection to where I'm from, it gave me like the perseverance, right? And then being here has gave me the love and the aloha and the really like the kuleana as well, right? It's given me this deepest reverence to protect and to love, and the cultural connection of, what the energy of this aina has like provided me, and also has provided me to also like give back to my community. And then I think the ancestral connection is the biggest thing, because I feel like it's my duty to give here and also to give back to my home as well. And so to see how both of them intertwine is always beautiful to me. And it's like, I really appreciate the women who have sacrificed before me. And, talking about my mentors, Selena Green was one of them who really taught me how important it is to give back. And also being here on this land, this native land, why it's so important to honor it, to respect it, to come here humble, right? And so I think that is like the biggest connection for me. It's just that ancestral piece, that cultural piece, that humility. And so I'm going to forever stand by that, because that's, I feel like, what's kept me here. Right?
Yeah.
And so, to hope that answers your question.
No, it totally does. No. That's totally.
Yeah.
And the name of our podcast is Optimize Your Naʻau, right? And so what we like to ask all of our guests is, how do you optimize your naʻau?
Yeah, I optimize my naʻau as really just connecting with, again, going back to that ancestral wisdom. That's what guides me. That's what guides my hands. That's what guides the team that I have to protect and support my families. That's what guides my decisions and how I show up for you all. That's what guides literally every aspect of my being. And so I believe that being here again has really edified that, has really amplified that in so many different ways, because now it has guided me so much that if I don't listen to that,
Yeah.
that I make decisions that I wish I would not have made,
Yeah.
or I don't act in the manner that I should, you know, and it always comes back to that. So yeah.
No, we can totally see it and we feel it.
Yeah.
Sure. That optimizes you. I can tell you just light up when you talk about it.
Yeah. And I feel like that's really what drew us to you.
Yeah.
You know,
for sure.
So we're so grateful.
Thank you.
Yeah, thank you.
And so excited for the rest of our birthing journey.
Yeah, excited too.
Yeah. But thank you so much for your time. You know, and for having some of these conversations can be tough. You know, especially if it's not your normal type of conversation, and so we really appreciate you sharing your knowledge and your feelings, and
Thank you.
Thank you.
Thank you.
Again, we are with Jasmine Merritt, Essence of Birth in Honolulu, and you can find all of her contact information. We will list it below in the notes. So thank you for joining us.
Thank you.
And aloha.
Aloha.